Welcome back to Bombastic Nation and Ting and Ting and Ting. I'm Mr. Giant and I'm back with some more vibe for all you. Yes, I am. This one is called What Americans Don't Understand About Public Health Care. Hotbed issue here. Hotbed issue here. People don't think the government should do health care because, they think people should be able to choose, what they want and stuff like that. But I ain't gonna talk much now. Let's go ahead on YouTube and Sim and see what they're saying, and then I wanna say something in the meantime. You know what I mean? Let's YouTube and Sim.
Public healthcare has been a constant re-emerging topic of contention within United States politics as far back as I can remember. It is a topic of contention in the current election cycle and will in all likelihood be in future elections.
Oh yeah, they ain't gonna fix it.
This American debate as a European living with such a healthcare system, there is however something that has always been strange to me, which is that not one proponent of such seems to have an idea of what it is, how it would work, how such a system would be built, and what it would require from everyday citizens as well as society at large. Most American proponents of public healthcare seem to get their idea of what it is and how it works from a Michael Moore movie. A movie that does an absolutely awful job at presenting the systems we have in European countries. All it really does is show us English and French doctors and nurses proclaim how superior these countries' healthcare systems are, and that's pretty much it. But there's far more to it than that.
Yep.
These two countries have vastly different systems and are more on the extreme ends of what public healthcare is. Especially giving England as an example of a great public healthcare system is somewhat ridiculous.
Okay, let's see what you're saying now. No, that went in a different direction.
It's one of the worst healthcare services in Europe. Created during the 1950s in the post-war consensus, an age of massive centralized government organizations and public spending, the NHS was plagued from the beginning with a massive entangled bureaucracy. Detangling and reorganizing the system during the 1970s barely fixed the problems. Things were made worse under the Thatcher administration through the introduction of a management system intent on cutting back costs and increasing efficiency.
Well, she was a conservative. Of course, she's going to try to dismantle the vibe.
He believed that a public service could be run like a private company despite having no market competition.
No.
His government introduced a system of quotas and standards meant to artificially replicate market pressures. This was meant to make the overall service more efficient, but in the end accelerated its declining quality. Subsequent British governments have done little to resolve these issues.
You're polytricksters, man.
Not all is bad on the British Isles, though. In 1999, Scotland retained control over healthcare legislation from Westminster for the NHS Scotland. They avoided the Frankenstein reforms Tony Blair forced on England, created their own institutions, smaller bureaucracy, centered around 14 local health boards.
It's a right way and a wrong way to do the
manage
thing.
these regional healthcare needs. Overall, Scotland's public healthcare performs better, and giving England as an example to Americans of how a public healthcare system is supposed to operate and work is just a giant misconception and misleading. England is an extreme example, and it is more of an example of how not to do it.
Understandable.
France is on the opposite extreme. The services look amazing to foreigners, like the fact that every mother gets a nurse assigned to her by the government to help her out for the first 2 to 4 years of motherhood, until her kids are old enough to go to kindergarten, which, in France, is also government funded. But what Michael Moore and others who praise the French system don't show you is the enormity of costs and the size of the apparatus behind this system. France, on average, spends between 12 to 15% of its national budget on its healthcare system. Every French citizen is required by law to pay into a national health insurance fund, the amount of the fee being determined by the individual citizen's income. France also has taxes, for example on gambling and casinos, the revenue of which specifically goes straight into the National Health Insurance Fund. The system, which is centralized and run by the Ministry of Social Affairs, Health and Women's Rights, only works due to the massive amount of funds and resources allocated by the French state to ensure its viability.
You know what? Here's the thing. I would not mind paying higher taxes or a healthcare tax. Let's just make it a tax specific for healthcare. I wouldn't mind paying that higher tax or more tax to get healthcare. I won't. I wouldn't mind it at all, as long as I know that money is going towards that. Because you know that, well, I don't know how it is in England and the rest of the world, but you know that money ain't, because they want to take money from here and put it into the military, take money here and put it into there, and then just like pay it, but switch it around and thing. So I wouldn't mind paying higher taxes if I know I'm going to get health care. I paid for health care at a workplace, and I worked there for 20 years, didn't use it once. And the one time we tried to use it was where my wife went to the hospital because the dentist office wasn't open on that weekend, and she went to the hospital to pull a tooth out and said, no, we can't pay, that's dental, not medical. Even though she went to the hospital, they find every way not to pay for it, so you end up paying for it anyway. And to this day I hear those stories for people I work with. And everybody want to privatize everything. Why would I trust somebody who's in it to make money, to look out for my best interest? Because they want to make money, especially in a capitalist society or country or system. They out there to make their money. When money is thrown into the mix, people don't really think of others because they want to live a certain lifestyle. And you can't vote them out if they don't take care of you. You could stop going there, or you could change insurance companies, but then that's another private insurance company that's going to take you to the rigs anyway, because they're trying to make money too. But if it's something that's organized by the government, hey, they start screwing it up, you vote them out. And terms probably should be less. Because if people know they're going to lose their job if they don't do the right thing, as it is now, you vote people in here for 4 years, that's a lot of damage they could do in 4 years, because they know it's very rare people get kicked out of that situation. Because the other politicians ain't gonna kick them out. They're all buddies and colleagues. And then you have the insurance companies and the pharmaceutical companies giving money, donations to the politicians. So who do you think the politicians going to look out for? The masses or the people who's paying them? And paying them well. It's not like they're not paying them enough. They're paying them good chunks of donations. Whereas the working man, he's just getting paid pennies. So it's easy for him to go up against his company because he's not making much anyway. But it has to be done like the guy said, it has to be done right. The problem is that the politricksters are the one that's instigating it, that's implementing it there. So of course it's going to have all kind of bureaucracy and all of that. Of course there's going to be all kind of craziness in there. They're politricksters, you know what I mean? Healthcare professionals should be doing it? I don't know. We don't know, but something has to be done because, a lot of people can afford healthcare. And we go back to the whole, when we were talking about the European Union in another video, it goes back to, if you vote people in, they're supposed to help take care of you. I was talking to somebody the other day at work, and they said they vote in the people to take care of the military and something else, and that's all he's thinking. And I was like, what about every day-to-day life? Better wages. Why am I you leading me? Why aren't you taking care of me? Same thing with healthcare. I vote you in. I'm not supposed to be worried about, paying exuberant amount of prices for healthcare. And a lot of the times it's out of pocket. Supposed to take care of me if I vote you in. Not to mention, you getting paid by my salary. I'm paying taxes so you could get paid. So what am I paying you for? If I go to work and I don't do my job, they're going to fire me. You become a politician, you don't do your job? No. He's got the right ideology that I want to hear. So let's leave him there. It doesn't make any sense, man. But anyway, let's go. I could tell I don't like polytricksters. I ain't gonna leave that out there as nothing, man. I don't like polytricksters. I had family members who were polytricksters.
It works because the French are willing to pay the taxes and fees required to make it work.
Boom.
And this is where we go from Americans having wrong impressions about public healthcare to their understanding of it being also somewhat flawed. Because the debate about a public health
I had at the university I was there. There was a French lady here, and she was teaching at Marshall. The Marshall is a university that went to Marshall University is called, and she was here for a couple of years. And this is how I understood it. Okay, she's gone for so long. She's not paying taxes. When she went back home, she had to pay out of pocket for medical expenses, and she said no. She packed up and went back home. Just so she could have that. No, I don't know if it's working for them. It's apparently there's flaws. There's flaws in everything. We just have to work together. We ain't got to sit back and let them polytricksters do it. We got to pay attention, man. Because, are they going to do what we want? I don't trust them no more. I don't trust the politicians from the day I was born. Let's go.
It's about far more than silly pedantic meandering over whether or not it's communism. It's a debate over structure, taxes and social sacrifices made, as well as burdens upon the individual or society at large. Whenever I saw a Bernie Sanders or other US politician continuously talk about how much they want a public healthcare system, the only thing they ever talk about is how much they want it, how great it would be for everyone, but never about what it means for the country and how it would be structured, built or implemented.
But nobody knows.
Questions, however, that must be asked, like, is the US government even willing to allocate 12% to 15% of its annual budget into such a system?
No.
How well would it bode with ordinary US citizens to levy additional taxes from them for such a system? Because the bottom line remains that taxes paid to ensure the functioning of such systems in European countries are not just levied from super rich, no, they are paid by everyone.
I'm willing to do that.
It will come down.
I'd rather have healthcare system, good
And
healthcare.
if you do not have this conversation as you campaign for public healthcare, you will eventually be forced to having this conversation when you try to implement it through the legislature. Beside the financing and taxation aspect of public healthcare, there's an additional aspect never talked about in the US political debate. If you are an American and you have ever been to Europe, you may have noticed that Coke tastes different here. It's less sweet. The reason is that our governments regulate the contents of sugar and take an interest in how healthy or unhealthy the products we consume is. Some countries, such as the UK, even have a sugar tax. Denmark has a tax on fat. Most European countries have high tobacco tax. Sweden has a very high alcohol tax. European countries have the strictest regulations on food quality in the world. Even beyond just a simple what we eat and drink, it is also how we buy that is regulated. The UK, for example, bans the advertising of candy
and that's what a government should do. 50% of the stuff people eat here are killing them. I'm gonna leave it at that. Like, I like sweets, but everything is so bloody sweet here, man. It's like you have a chocolate bar and it's like you get drunk off of the sweet on that stuff. I don't eat that stuff very much. I absolutely don't eat fast food at all, period. My daily diet is mainly vegetable without dressing and stuff on it. I don't even eat guacamole that come from avocados or pears like we call it on the island. I don't eat guacamole. I like the natural taste of the pear, man. Or the avocado. I'm sorry. I'm speaking to Grenadians. I like the natural taste of the avocado. I like the natural taste of the broccoli. I may put in a little bit of natural spices in there, tropical spices. Or I may put a little olive oil in there or something. But all that dressing and stuff, man. God, that stuff is just like... You know what I'm saying? So yeah, regulate that stuff, because people aren't going to regulate themselves, especially when they're struggling. They want something to make them feel good, so bam. And sweet stuff does taste. Every once in a while I eat a chocolate bar, pay for it. But when I feel like I'm done, I want something to get me off the... eat up that chocolate bar and thing, you know. But there's got to be some kind, because it's just like tobacco. There's all kinds of additives in it, and it becomes addictive. I know. I used to smoke, and sometimes every once in a while I smoke a cigar as it is now. But that stuff is highly addictive, man. You Jones for that stuff. Let's keep going.
The UK, for example, banned the advertising of candy and sweets using cartoon characters or any other advertising method that specifically targets children. Outside of food, there are government incentives and initiatives to keep citizens healthy, from subsidized fitness and sport initiatives down to extensive fitness programs for school kids. Why? Let's leave Europe for a great example for why. Japan has a public healthcare system. It is one of the best healthcare systems in the world in terms of quality and efficiency. Japan is also the country with one of the world's best healthcare systems that spends the least money on it, because Japan also has the healthiest population in the world. Once you have a healthcare system that is financed by taxpayers, the taxpayers, and by that extent the government, have a vested interest in the health and well-being of the taxpayers. Or rephrased, if you are morbidly obese in the United States, it is your responsibility, or should I rather say, your lack of responsibility. It will reflect itself within the costs you pay to whatever insurance company
Sorry
you
about
sign
that.
up with. You pay the consequences, not just in diabetes and cardiac arrest, but financially. In a country with a public healthcare system, if you are morbidly obese, costs for your resulting treatments are paid by other people's taxes. It is consequently no longer just your responsibility. If you are fat in a country with a public healthcare system, you are a burden on society. And there's a question to be asked and answered of whether the people...
Instead of implementing stuff like that to make people healthy, they go, oh, don't fat shame, and these people get sick, and then bam, they're there. They have no money for health care, but somebody's paying for it. Instead of making people healthy. I'm not saying people aren't predisposed to being overweight. That happens. But I work at a grocery store. I see people come down the pike with all kind of preservatives and food and stuff. Very rare I see a whole lot of vegetable. No, I've seen that a lot. People are starting to get more healthy now, and I think it's because of the current situation. They figure boosting the immune system and thing. Because a lot of stuff that I used to be able to buy that's healthier, the shelves are empty of them. You know what I mean? But it's like they throw it back in your face, man. They're like, So why are you saying that? Why are you trying to shame me? I say, man, be healthy. Be healthy. See these young people come in there and they ride in the little motorized thing to go shop. So I'm way older than them. But they're not healthy. And it's not a matter of shame. Why don't you want to live a healthy life? Why don't you want to live a long, healthy life? I don't get it. I ain't fat shaming nobody. Hey, I'm not exactly, I might look skinny, but I've got a little gut on me here, you know what I mean? I need to eat healthier. And I've been trying, I say 85% of my diet is healthy. At work, they say I eat twigs and branches. Raw, natural.
...of the United States can even put up with such a standard. Personal responsibility and independence is at the core of the country's identity. Seeing your actions and your life within a wider framework of how they impact society at large is not necessarily something attractive to many Americans. Additional taxation on unhealthy produce, as well as a government-sponsored and encouraged incentive to live healthy lives, is also something that most Americans would probably not even accept.
Yeah, it's communism, they scream.
Bloomberg attempted to ban the biggest sized soda bottles in measures intended to incentivize healthy living for New Yorkers. New York, being a place that would probably be pro-public healthcare, protested that measure substantially to the point that it was rejected. However, in a conversation over whether or not to have a public healthcare system, such measures are part of the conversation and are simply unavoidable. Yet the proponents of public healthcare in the United States don't ever discuss this. American politicians...
Okay, let me give you an example, okay? Loretta, and I've mentioned her before. She teaches in a high school here. And they have what you call food stamps. And it's government money, you could say. They give you this to survive and stuff like that. And it's paid for by taxpayers. And at one point, they wanted to ban having pop on there, and this one, uh, well, actually, no, they didn't want to. Mm, Loretta told the student that, hey, you shouldn't have pop on your food stamps. And the student that she was talking to got upset and said, hey, why? That's one of the things I look forward to. Looking forward to the unhealthy stuff to eat. And get upset when somebody said, hey, you should be healthier. And I know people going to say it's none of your business, blah, 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 but in the long run, is it? Isn't it? Isn't it that's what causing the burden on a lot of stuff? And, and like I said, I'm not, as they say here in America, fat shaming nobody. I'm health aware in them. You know what I'm saying? Because I never talk bad about people as per se, unless you're a polytrickster. Then game over. And some preachers. But yeah. But anyway, human beings are going to do what's not best for them. And somebody's going to, go, hey, you know what I mean? This is this, that is that, let's take care of this, you know what I mean? But they're too busy doing platforms that would make them have power. Polytricksters. I'm on a polytrickster kick these
only
days.
ever say that they advocate for it, but never actually lay out any policy plan for how they would finance such a system, or even what such a system would look like. But also more crucially, how they would incentivize Americans into being healthier. And that is an important conversation that must be had, especially when you keep in mind how unhealthy the average American is. A public healthcare system is not intended to be a daycare for obese people to continuously even out the consequences of their irresponsibility. And if you introduce a public option without incentivizing a healthy public, that is exactly what your healthcare system will turn into. I personally don't believe a federal centralized public healthcare system like in France would work in the United States. The country is too big, the bureaucracy would be too large, the taxpayers unwilling to pay, and the political landscape unwilling to put up with such. In France, there's a consensus amongst both sides of the political aisle to ensure the healthy state of their healthcare system.
Bam!
They
cannot work together.
Exist in the United States. If a Democratic president were to introduce it, it would only exist until the next Republican president.
Yes.
Additionally,
yes.
I don't believe a centralized federal healthcare system is even desirable. The system I prefer the most is one you got a taste of in the beginning of this video. Countries such as Germany and Austria employ a system in which healthcare is federally mandated and even subsidized, but implementation of the system is largely handed over to the individual states. I don't believe that a top-to-bottom federal healthcare mandate would work in the United States. And what I would propose to Americans who wish to have such a system is to abandon the idea of a federal public healthcare program. The legalization of cannabis shows how reforms are best implemented within the United States, namely through legislation in the individual states to then convince those in other states of the viability of the reforms. I believe it would be better for the American advocates of public healthcare to campaign for public healthcare in their home states through state legislature and the governor's office. Not only are such efforts more likely to bring results, but would also achieve a public healthcare system without
this is good.
Of having the federal government step in and dismantle it if those in power of it oppose it, as the centralised British government would have done to Scotland if they hadn't retained control of their healthcare service in 1999. Such a regional system is also more efficient and more in touch with the people within the comparably smaller state it has to serve, and the advocates of a public healthcare system would also be more in touch with their own communities, and therefore it would be easier to debate and implement subsequent other measures incentivizing healthier living and finding the revenue source for the system.
Oh, I like that. I like that last part there. Subsidize it, but don't take it over. I never thought about it like that before. That's pretty cool. And local polytricksters should be a lot easier to control than federal, because they're up there, they don't come see you. But you see your local politicians every day, and you could go, hey, yo, bro, what you doing? People don't do that anymore. They're too busy yelling and screaming and insulting instead of saying, man, let's sit down and have a convo. Of course, a lot of politicians don't, because, get an appointment and come to my office. Oh, ye plebeian, you should not speak to me. How dare you speak to me? I'm exaggerating, of course, but that's what it feels like. But anyway, man, thank you all for watching this with me. Remember, Mr. Giant T-shirt, the link will pop up here somewhere, and it's in the description. Hey, check it out. If you like it, copy one according to the kids in them, you know what I mean? But anyway, man, other than that, the link in the description for this video, you can go check it out. I'm quite sure there is more like that on there. This is the first video of this I've watched, so I'm gonna be watching, looking out to see what else they got, you know what I mean, and thing. But listen, y'all take care of each other, all right? Cool runnings.